My dream back in the day before I went to dental school and I started lifting weights, I told my wife I was going to be a pro wrestler. She said, "No, you're not." I said, "Yeah, I might be a pro wrestler." So I was going to go down to the Dallas Sportatorium and wrestle. I was going to be the medic or some cheesy name like that. I think it was about 2014. So I need to try something different. So I went to this boxing gym. I went there. I had my spleen fed to me for the first, 3 or 4 months, but it was refreshing. And I would fight through the pain. It hurt so bad, but in reality, it felt good. Look, no, I think this is a better look. I'll see you in a minute. Okay. So you come to work and your demeanor's different. It's just completely different. You're like, "How you doing, man?" "Doing all right." "Wow, that felt great. I think I need to go tomorrow." It's kind of like going there and you just punch your struggles away. You can actually problem solve while you're in there just hitting the bag or running or whatever. It actually slows me down a bit. As I got older, you go through school, raise family, and you lose track. You don't even know what a hobby is anymore. I know I like to cook. Jerk chicken, and that's a Jamaican dish. My wife's Jamaican. Certain dishes she mastered, like she loves to cook oxtail. Her dish is jerk chicken. I said, "You know what? I need to make this chicken myself." So I started experimenting with the recipe. First, I used a seasoning from Jamaica. I said, okay, then I would start augmenting it with other different spices. I'm gonna make my own sauce. Over the years, I just started experimenting with it. I love it because it's just something I can do, and it's fun. I know I don't like to cook, I love to cook. And I said, okay, I need a little more than that. The boxing came in, and that became a passion. And then after that, I discovered motorcycles. It's funny, the cars these days can almost drive themselves. So you can get in there, play on your phone, play the rails and everything else. A bike, you have to be aware of everything around you. The other cars, the stoplights, the bumps in the road, bugs flying at you, the weather. So there's so many different factors to pay attention to. A lot of times we're in life, we're just tunnel vision. This is the mundane. The bike, it makes you aware of everything. And that mental awareness keeps you sharp. Some people do puzzles, luminosity, things like that. The bike is your own human luminosity. Now, I can't let the motorcycle supplant my love of cooking, but it's coming real fast.
I'm not signing any waivers. I just got drafted by the Bucks. I'm going from the Redskins to the Bucks. So.
I met Tony Polk first week of dental school. We can roll out. I said, I'm running with this dude.
Vincent, I think, is that one on the side street.
He's the first guy that taught me how to relax.
We can just split forces from there.
Okay.
A lot of times when we come from the communities that Dr. Polk and I have come from, sometimes folks leave and they don't come back. I think that's a big mistake. You have to go back because there's somebody behind you. And there's somebody in front of you that paved the way. So either way it goes, you still need to be involved.
How you doing? Well, yeah, I'm doing good. Good morning.
Sometimes the patients feel like they are left behind by society or the world. So we want to bring those folks back in. I feel like that's what we're supposed to do. These are patients that are unable to get proper access. We want to find those patients and identify them. We can bring them to the office to where they can receive care in a private setting.
That's going to be our very next priority.
A toothache pain is like a heartbeat. Every time you move or think or breathe, it hurts.
Rest that head back for me, please. Open real wide.
And then you magnify that if you have other systemic conditions. We can solve that problem within a matter of a few minutes for them in most cases. And that toothache may have bothered them for 6 months, a year. You'd be surprised at the stories that we hear. We'll have patients that will come in and they're dying in pain. We'll get them numb. We can have that tooth out within 5 minutes. We talk to those patients, we're able to talk to them about more than just dentistry, and that's often what we do. We try to be a resource more than just, let's fix your tooth. You work hard, you get a chance to play hard. You don't work till it means, I need to go here and then I can relax. No, that's our approach to life. You find ways to relax, because my true personality, I could work 7 days a week. I learned that my vice is relaxing, breathing. Between birth and death, there's a life to live. And you have to capitalize on those moments every chance you get. Makes you a better person, and then you become a better dentist.
In every country that we